Today, I'm proud to announce that we're launching a dedicated street psychiatry team throughout Albany County. And what that means is we're going to meet people that are on the street. And unfortunately, after COVID, even before COVID, but it came more and more of a problem after COVID of having more people, homeless people on the streets. The mayor's going to speak. I'm not going to speak for her. It is her city. But it's just not the city of Albany. So I just want to say to everyone listening to this or watching this, this program we're launching is just not in the city of Albany, it's throughout the county. So we're going to be doing this in other parts because, Colony has issues, Cohoes, Watervliet, Green Island, Bethlehem, Guilderland has issues. So it's just, I know everyone likes to focus on the city, but again, it's throughout the whole county. So this program's not only kicking off here in the city of Albany, we're kicking it off across the county. So it's a national recognized model to engaging individuals who have had been unable to get the help that they need, follow through on their help. And we can assure you, that was one of the reasons why we did the pharmacist inside our mental health building, is because we realized as we were treating patients and you give them a prescription to go get it filled, they were never going to the pharmacy. We found out it was easier to do it right there, give them their pills to make sure that they get the medicine they need, right? So this program too is going to be doing the same thing. We're going to meet them on the street with a team, and I'll break the team down in a minute, but basically we're going to give them their prescription right there, right on the street to go get filled, so they can really get the help that they need to move forward. We're also going to be looking at housing, finding different programs they're entitled to, and really take a different care approach. And I'll say this, there's people on our streets that don't want to come off our streets. You can give them all the help you want in the world. I've watched a poor family from Bethlehem come in and try to take care of their son that was living in the city streets in Albany for 5-6 years, and he didn't want help. He didn't want to get off the streets. It's unfortunate. You run into that situation too. But from 2020 to 2024, the total number of unhoused or homeless individuals in Albany County increased 27% from 676 to 857. In the same period, the total number of homeless individuals living with behavioral health issues increased by 67%. For many, untreated mental health issues contributes to housing not being stabilized for them, right? And as you know, down in Manans, we opened up the Veterans Center for homeless veterans to get them off the street, and the veterans that couldn't make it anywhere else. But housing is a tricky issue. It's not just a county issue, a city issue, a state issue. It's a national issue about housing. We can't build our way out of this, so we have to figure this out. But the team's going to consist of 6 positions, a nurse, a mental health clinic person, case manager, mental health peer advocate, certified alcohol and substance abuse counseling, and a medical professional that are all going to be working in a team to get this job done. The team will meet, again, directly on the streets and parks and other public places. They will perform evaluations in the field of behavior health, serious mental health issues, or addiction. So again, meeting where the rubber hits the road. And this is what this program is so important. We looked at other models from California. It's all over, the good, the bad, what works, doesn't work, feedback from people. So, having a family member that lived out in California for almost 28 years on the streets, and changed it around from a program like this that got off addiction, got off the streets, and now is giving back and trying to help other homeless. Again, we can't do this without a partnership, so I do want to thank the people behind us. This program will build upon existing community behavioral health resources and will complement and enhance the current range from the Department of Mental Health Services and support, including community crisis response and outreach, and the variety of the other programs that we do currently on the streets of the city of Albany and throughout the county. We cannot address the homeless crisis without addressing the mental health crisis. We've talked about this. It's a different world we're living in since COVID. I know it's only been 5 years, but things are different, right? From working remote, not going back, schools. We're seeing kids that were in high school having more and more mental health issues now, that have dropped out of college just for a variety of reasons, interaction, whatever it might be, still adjusting to everything. Again, I want to thank Mayor Sheen and Chief of Police Brendan Cox for their partnership. Part of this program launch is in thanks to the $250,000 granted by the City of Albany. I want to thank the mayor again. I want to thank the Albany Police Department, the Albany Fire Department, that obviously have these issues day in and day out. Again, I'd like to thank Chairwoman Cunningham, our partners in the legislature, for the support. Susan, thank you. It is your district, so I do want to say thank you. We are going to be in there. I would also like to recognize our Department of Health, Dr. G, our Deputy Director, Cindy Huffman, for their work on this as individuals. You two are a great team. Continue to think outside the box and do extraordinary stuff. This program, if we can change the outcome of someone on the street, trust me, the services that the county provides, the services the city's got to provide, and all the nonprofits in the city of Albany and throughout the county that have to give back to this person, a lot of money goes into it. So what we're doing is not working to a degree, and hopefully this program will change that.
And while we know that we need more mental health beds, we know that we need additional solutions, the challenge that we have in the city of Albany is that we are the Region 1 Trauma Center. So everyone with mental health challenges that ultimately require an emergency room visit are typically coming to the city of Albany. They are getting some form of treatment, but too often they are being discharged right out onto the sidewalk. And so these are the sons and daughters and husbands and wives and parents of people throughout this region, and they need to have the opportunity to access continued care. And one of the things that we've seen is that people get discharged, they have that prescription, they're great for the next 30 or 60 days, however long that prescription lasts, but then they don't get it refilled. They don't follow up with the appointment. And this is an opportunity to have actual prescribers available to folks so that they can get stabilized and then, we hope, get the care that they need. So we started with the Albany Navigates program, thanks to Albany County, a partnership using our opioid resettlement funds to do case management. This is now taking it a step further. This is allowing for actual treatment to occur where people are, with the goal of getting them stabilized and getting them the help that they need. And it does ultimately save money. And so you're going to hear from the chief as well. We're also investing significant city dollars in case management within the police department, but they will be ultimately supervised by Albany County Mental Health. This is how partnerships work. This is what our residents and taxpayers want to see. It's what they deserve to see. And I will say this. What is happening in Washington with the reconciliation bill is something that should be front and center for every single person in this room and every single person who is going to hear about this. Because this program becomes sustainable when Medicaid reimburses for mental health services. And we need to ensure that those who are representing us in Congress understand that this isn't just a mental health issue. This is a public safety issue. This is an issue that our police chiefs should be talking to members of Congress about. Yes, I was in Senator Schumer's office. He understands this, but we visited Republican lawmakers as well to say this is the model. We know it works. And so we need to have Medicaid as a resource, because once individuals get that case management that they need, most of them qualify for Medicaid. And Medicaid needs to have parity in paying for these mental health services because it works and it ultimately saves dollars. So that is why I will likely go back to Washington in a couple of weeks to make sure that we are bringing the voices of those of us in this room and our residents out there to Washington to understand how important this investment is, because that is the glue that allows this to really stick and become a best practice that our residents can rely on, so that when the next person falls into either having a traumatic situation, a mental health crisis, diagnosed with a mental illness, that we have the support and the system in place to ensure that they do not literally, because what is happening is people are literally dying on our streets. And it has to stop. Every person is worth this investment. And so I really want to commend the county for taking this step. It's critically important. You're one of the innovators, you're on the leading edge of this, and this is a program that you'll be able to brag to your fellow county executives about at your next national meeting, because this is really a game changer. Thank you for your leadership.
Good morning. How's everybody doing? So it is a great day for the city and for the county. This is truly a partnership, and this is about public safety. At the end of the day, public safety is about a number of different issues. Public safety is about crime. Public safety is about disorder. Public safety is about public health. And what we're trying to do is make sure that we address everything. Because we can sit here and we can talk about Part 1 crime data all we want, and we can talk about the fact that crime continues to be lowered in our city. And people can continue to say, well, I don't feel safe. And that's because we know that we also have an issue around a lot of people that are unsheltered, a lot of people that have unmet behavioral health issues, a lot of people that are living with substance use disorders, with mental health issues, and are living in very public view of all of us. And they need help and they need assistance. And people want to see a response. And those individuals aren't going to make it into a doctor. They're not going to make it into a clinic. Let's be honest. I think I have my life together. If it wasn't for my wife, if it wasn't for the fact that doctor's offices call me the day before I'm supposed to be at an appointment, I wouldn't make it into a doctor's office. I barely make it in. I usually have to adjust my schedule like 24 hours out because I'm like, oh, I was supposed to be into a doctor's appointment. If my wife didn't go pick up my prescriptions once a month, I wouldn't take my prescription medication that I'm supposed to take. She's the one who keeps my life together for that part. So we all need people to help us out. Folks that are living on our streets, we need to go and we need to meet them where they're at. If we don't get the clinic to them, we're just going to continue to see disorder. We're just going to continue to see people struggle. If we don't get people, clinicians, to them, we're never going to be able to get them sheltered. We're never going to be able to get them to where they need to be. And at the end of the day, our residents, our businesses, our visitors are going to continue to say, hey, wake up, Albany, why aren't you doing something about this? And they're going to continue to use three numbers that nobody should ever have to use to deal with a situation that is not a police issue, but yet police wind up being the ones to deal with, and that's 911. So we have to change that. So this partnership, thanks to the funding that's coming from Governor Hochul's office and the partnership between the county, the city, office, the Dr. Giordano staff, our staff is going to be able to do that. So now we're going to be able to have a boots on the ground response for a clinical response. And it's going to build in to an entire spectrum of responses. From lead, where we're able to stop arresting people with substance use disorders and mental health issues that are embedded in the system, to Albany Navigates that help shelter people, to our crisis caseworker initiative within the police department, where we're going to be able to start taking those low-level calls for service that have folks with unmet behavioral health issues or folks that are unsheltered, and we can stop sending police officers to those calls. We can have this whole spectrum of responses that don't always have to involve the police and can start getting people the services they need and increase public health, increase public safety, and do it in a different, innovative way. So I just want to take a second to recognize and thank a bunch of people, including the mayor, the county exec, Dr. G, Cindy Hoffman. These guys are great partners behind me. I also want to thank my team. So Commander Nora Riviella's in the crowd here. She's doing a great job putting this together. Lieutenant Devin Anderson, Sergeant Ben Peterson. So I also have, I have to cheat for a second, but I also have Director of Communications Christina Colucciello's in the crowd. Project Manager Megan Yellen is over there. They're doing a great job really getting this together and making sure that our crisis caseworker initiative is built from the ground up. And then our senior crisis caseworkers are also here. The senior crisis caseworkers are going to be supervising our caseworkers that are going to be on the ground, responding to calls, recognizing that we don't need to always send police to our unsheltered folks, to folks with mental health issues. An initiative that we're really proud of that's going to be off the ground, going to be helping our police officers, going to reduce calls for service, something that we need to do as we address things. So Jill Potter, Diana Macy, and Brooke Latard are here, and really proud of that team as we start to build this initiative and really complement the street psychiatry program, they're going to be able to make direct referrals. And as we see all of these pieces come together, we'll especially see people on the street lifted up, really get the services they need, and really proud of the work in this partnership as we come together. So thank you.
Again, I do want to thank everyone, and especially the partners that are up here on the stage, and can't be done without our partnership in the legislature. And I think you're going to hear more of them about housing issues as we go forward in these next couple of months, because we're trying to figure that out too, in a partnership working with the chairwoman, deputy chair, who's very is so focused on housing, and so Sue and everyone else. So thank you so much.